pleasure to introduce Sheila Duffy, who's very much a friend of the Global Health Management Programme and comes each year to talk about the work of ASH Scotland, Action for Smoking and Health in Scotland. And this is a group that's been around since the 1970s, a health charity that's about raising awareness and providing robust information about tobacco use, tobacco control and regulation, etc. I think this talk fits well into the health system and policy course, particularly going back to yesterday when we were thinking about change and working with policymakers, and it's a whole new world. And I think the work that Sheila does with ASH Scotland demonstrates how that change is achievable, no matter how large a task it must be. Anyway, enough from me. I'll hand over now to Sheila.
Well, it's very good to meet you all. I hope you can hear me well enough. And if I use any terms that are unfamiliar, or if I speak too fast, put your hand up and stop me, because I think it's a small enough group we can be informal. So you are the influencers in the world of tomorrow. And I'm here to talk to you about the subject I know best, which is tobacco. Tobacco is an epidemic. The substance is lethal when used as intended by cigarette companies, and it will reliably kill 1 in 2 consumers, and recent cohort studies suggest as many as 2 in 3. It is, for many people, highly addictive or dependency forming, and it is an addiction that is often picked up in childhood and young teenage years before people really fully understand what they're getting into. And in Scotland, the majority of smokers say they wish they weren't smokers. If they could do it again, they wouldn't be. So our vision and our aim is to free the next generation from that lethal addiction and the commercial forces behind it. And this is just a brief outline. I'm going to talk mainly about Scotland because, again, that's what I know more about, but just start with a bit of a global overview. So tobacco kills around 6 million people globally every year, and it is projected on current trends to be 1 billion deaths in the next century. And most of that death and the illness that lies behind it, because for every tobacco-related death, there are about 20 people living with chronic disabling illness. Most of that burden will fall on countries who cannot afford it in terms of their health systems, and who are already trying to deal with a number of other pressing health issues. So it's a double burden for middle and low-income countries where the tobacco epidemic is on the rise. And this is kind of what the curves look like. So the red lines are people starting smoking, men and women, and the grey lines are the diseases that follow people starting smoking, and often it will take 15, 20 years for those diseases to manifest themselves. So the rise in smoking rates in other parts of the world where there isn't the same stringent regulation that we have here has been described as a car crash in slow motion. You know, we will see the damage to people's bodies and people's health and people's lives a decade or 2 decades down the line from tobacco. And the tobacco companies don't care because they are primarily driven by making profits. They will push their products within the law as much as they can. In some countries, they've been accused of pushing them beyond the law. So we need an international response, and tobacco is the only subject, the only sort of health issue which has its own global public health treaty, the Framework Convention on Tobacco Control. And that sets out some of the baseline hygiene measures you need to put in place as a nation to be able to try and reduce the harm of tobacco and the tobacco epidemic. So it's things like price and tax increases, which is the most evidenced measure internationally and the one for which there is strong evidence it doesn't increase health inequalities. Bans on smoking in enclosed public spaces because tobacco smoke causes health harm to people, and there are particular harms with children. Requiring warnings on packs because tobacco isn't sold on the experience initially, it's sold on the image, the dream, that it will make you feel confident, it will make you sort of rugged and masculine or glamorous and feminine or whoever it is they're trying to sell it to. They will market the image and the dream at people. Prohibiting advertising because tobacco is completely counter to public health and advertising is designed to get people interested, get them taking it up, and most smokers take it up as teenagers. education and communication, and support to stop smoking. So those are basic measures, most of which we have in place in the UK. And much of the world is signed up to the Framework Convention with various degrees of implementing it. And Ash Scotland, my organisation, is an active member of the Framework Convention Alliance, the third sector non-governmental organisations who are pushing for this to be better implemented. And it's very helpful to share intelligence internationally and to have that support, because the tobacco companies try the same tactics in different countries, and you'll see the same misinformation coming up later in other countries that you've seen in your own country. Tobacco is a huge epidemic. It has a vast impact on premature death and disease and disability, and yet it's quite a hidden one. So we saw last year, for example, a huge amount of public health attention on Ebola, rightly so. The World Health Organization estimated the deaths from Ebola was about 50-50 from the people that caught it, and that's pretty much the same as tobacco. At current rates, tobacco is set to kill 1 billion people globally before 2100, and that's more than 200,000 times the current number of deaths from Ebola. And most of those who die will be dying in Africa. So we have to look at epidemics like malaria, Zika, Ebola, but we mustn't forget tobacco, which is a hidden epidemic with a vast consequence for public health and health systems. And the difference with tobacco is that mosquitoes that spread malaria don't have expensive public relations firms. They don't pay for influence on governments. There aren't front groups that promote the spread of cholera. And tobacco, the disease vector for tobacco is tobacco companies, and they are very consciously out for profit. So in Scotland, a conservative estimate is that there are at least 10,000 deaths that are caused by smoking, that are early deaths, lives cut short by smoking every year. And behind each death, 20 people living with chronic disabling disease. It is a huge burden on our health system. It is responsible for the high rates of lung cancer, but also other diseases, heart disease, strokes, diabetes, dementia. So preventing the next generation getting hooked into this lethal addiction is one of our main aims. And this is a World Health Organization graphic, and it's some of the forms of tobacco industry interference that have been noted internationally, and that's direct interference with public health policies. So trying to hijack the political and legislative process, and there's a lot of research on that at European level. There's examples in Scotland, there's examples internationally. Exaggerating the economic importance of the industry. So they will say that any measure you want to introduce will increase illicit tobacco. I've never seen the links proven on that. That it will devastate pubs or small retailers or whoever. Again, the World Bank looked at this and did some reports some while back now, and they said tobacco is poor value for any economy when you look at the totality. They will manipulate public opinion, and they will seed misinformation in the press. So we've seen in Scotland an employee of a tobacco firm, Will O'Reilly, who was a former policeman, going around discovering hotspots of illicit tobacco in Scotland and somehow managing to imply that it's linked to standardised packaging coming in, which there are no links that we have ever found. Fabricating support through front groups. Now, I came across the term astroturfing when we were campaigning for smoke-free enclosed public spaces in Scotland. And astroturf is fake grass. And astroturfing is creating fake grassroots opinion. So we've seen in America, for example, an alliance of retailers who are very influential with government, who expressed fears about standardised packaging when Australia was planning to be the first nation to bring in standardised tobacco packaging. And it was later revealed that they were funded by and orchestrated by tobacco companies and PR agencies. It wasn't actual grassroots opinion, it was created noise. We see a lot of that. Discrediting proven science, again going back to smoke-free enclosed public spaces in Scotland, we had an international body of research, yay high of papers from the floor that showed the harms of tobacco, and they managed to find one paper that had gone through a peer review process that cast doubt on it, and they pushed that everywhere. So they will say it's not proven, you don't have to worry about it yet, the jury's still out, there's still doubts. And intimidating governments with litigation and the threat of litigation. And that's really, in the last 5 years, a tactic that's come through strongly internationally. We've seen it in Scotland, we've seen it at UK level. Australia's had the book thrown at them.
Australian government had to employ 6 civil servants just to answer the freedom of information requests from tobacco companies and their friends. And the aim of that is to cool the regulatory environment elsewhere. So if Australia has to spend a fortune defending its public health legislation, New Zealand isn't going to be quite so keen to go next until all those court cases are solved, and other governments will look at it and go, we can't afford that, we won't do it yet, we'll wait till a lot of other people have done it. And they keep making profits while they delay public health legislation. In Scotland and the UK, there's a long history of legal challenges to public health legislation. They haven't yet won any of them, but they have delayed legislation coming in by up to 4 years because of it. And they can afford it. These are some of the headlines. It surprises me to remember that it's actually 10 years this March 26th since Scotland's enclosed public places legislation that cleaned the air of tobacco smoke came in. So it's 10 years. These are headlines in the papers just ahead of it being implemented. So criminals will win. We're hearing that about plain packaging. We're hearing that everyone will turn to illicit tobacco and the criminal gangs will win. No evidence for that. The smoking ban won't save lives. The science isn't proven yet. You don't know for sure. They're saying the same about plain packaging. Smoking ban will increase alcohol abuse in homes. And that was actually one of the interesting arguments was that people who couldn't smoke in pubs would go home and smoke in front of their kids and increase exposure. And that was the only one that we couldn't identify as clear misinformation because we didn't know. But fortunately, at that point, the Scottish Government had a little more disposable income than it has now, and it set up a very comprehensive programme of research to see what the actual effects were from the ban on smoking in enclosed public spaces. And what they found was that smoking did not get displaced into the home, but a number of people put in voluntary restrictions on smoking in the home or in front of their kids because they got that tobacco smoke was dangerous from the publicity. There was a reduction in the rate of child asthma admissions of 18% a year compared to an increase of 5% per year in the years preceding it. There was a 17% reduction in heart attack admissions to a number of Scottish hospitals, comparing with 3% in the decade before the ban. There was a 39% reduction in secondhand smoke exposure in 11-year-olds and in adult non-smokers, 2 separate studies finding the same rate of reduction. The air quality in bars increased immensely, and bar workers reported fewer chest infections, fewer throat irritations, fewer eye problems, and high public support for the legislation, I think because we had a really active debate for about 5 years in the run-up to it coming in, and people heard both sides of the argument. And one of Ash Scotland's important roles in that was to challenge the misinformation and say, no, you are saying it will devastate the pubs by 30%. That argument was used here, it was used here, and if you look at business tax receipts, it didn't happen. And we're seeing the same kind of misinformation on standardised packaging. It will ruin small retailers. In Australia, it disrupted them for about a week and a half, and then things settled down. And they said, actually, it improved their efficiency because they made fewer selection errors when they were just looking at the names of packs, not at the look of them. So, interesting. You have to keep tabs on what's happening elsewhere, and that's one of the strengths of working internationally and sharing information. So the Scottish Government was very new in 1999, and the smoke-free public places debate was one of the first that we had in our Parliament. So a lot of laws are decided at UK level by Westminster, business regulation, tax, we can't do that. But we do have devolved powers for health, and it was under the health powers that they brought in smoke-free public places. And it was one of the things that our MSPs feel proudest about. But having been through that process, what I observed was that the tobacco companies didn't get the potential for Scotland to move independently on this until quite a late stage in the debate when MSPs and parties had taken up their positions. And they brought in heavy-duty PR crisis agencies. At that point, they were offering MSPs free expenses-paid trips to Zeebrugge on the ferry. They were schmoozing them. They were trying to bring in the misinformation. But actually, by that stage, they pretty much knew what was happening, and they weren't for changing. And the Scottish Parliament took strength from that, and it has brought in a number of measures since then to control tobacco, I think on the basis of that early success. And the tobacco companies have learned from that, and they've got in a lot earlier with their misinformation, their challenges, and their paid-for influence. So there is quite a lot happening and changing at the moment in terms of legislation in Scotland. So at UK level, we will see from May this year, we will see standardised tobacco packaging coming in. I'll show you what it looks like in a minute. But this was voted through at the 11th hour in Westminster. They were swithering for a number of years. They had 2 consultations, and the first one said, do it, and they went, nah. Scottish Government, since 2013, was committed and said that they would do it if it didn't happen at UK level. And I think it was the attempt to regain some public health credentials that finally swung it at Westminster, but they did the right thing. They said they would bring it in. France is bringing it in May, a number of other countries with the Tobacco Products Directive allowing that sort of legal space to do it. So there'll be a year for sell-through, but from May you'll start seeing these packs, and in a year's time they will be mandatory. 2 pieces of legislation in the Scottish Parliament. The Children in Motor Vehicles Bill, that will make smoking in cars with children under 18 illegal. And it was a private member's bill by Jim Hume, a Liberal Democrat MSP. The situation for enforcement in Scotland is a little complicated because we're doing it under health. Technically, it falls under environmental health enforcement, not police. So they're going to have to work together because environmental health aren't out patrolling the motorways. And the police aren't that keen. But it's legislation that came in October last year in England and Wales, and it's likely to come in by October this year, maybe slightly earlier, but they will run a big public information campaign. So you'll see some of that, I'm sure, in papers and TV and so forth. The Scottish Government's health bill is a bit of a mishmash of measures. It was a space that they kept to do standard packs if Westminster didn't. And then having that space for health measures, they fitted in some sort of care and protection measures and some tobacco measures, like meaning that people under 18 cannot sell tobacco without supervision, so that brings it in line with alcohol. Age restricting the sale of e-cigarettes to those 18 and over, creating powers to take regulations to control domestic advertising of e-cigarettes, and taking powers to create a smoke-free perimeter around hospital buildings, which is something that the clinicians have been pushing for, because the policy is smoke-free hospital grounds, but it isn't legally enforced. So there's various bits and pieces in that bill. And then the Tobacco Products Directive at European level starts coming into force in May 2016. So it will also put restrictions on e-cigarette advertising, cross-border advertising, TV advertising. You will not be able to advertise these products as having health benefits unless they're medicinally regulated. And it will create a twin-track system for e-cigarettes where anything with 18 milligrams of nicotine per millilitre of fluid or less can be freely sold, but anything more has to go through medicines regulation. And it will mandate larger picture health warnings on packs, which will work well with standardised packaging. And there's also provisions in it for controlling illicit tobacco better. That's a bit of a fighting ground because the tobacco industry's got in there and it's proposed its own track and trace system, which has been criticised internationally as having loopholes that allow it to have a back door where its own products can escape detection. And there's been money given to Interpol, and there's been criticism of Olaf for being too close to tobacco companies. So we're not quite sure where that's going to take us, but there will be new measures about illicit tobacco. So this is what standardised packaging in Australia now looks like. A sort of muddy green background, which has been called emphysema green. And it's been tested as really putting people off. Plain fonts, so you don't get all the fancy descriptions and things. And the picture health warnings stand out. So to us, it makes the packaging more truthful, and it stops tobacco companies designing the packs to attract kids to experiment and then get hooked, because you can get physically hooked within about 8 weeks of experimenting with tobacco. So the packs that we have on display at the moment, you'll see ones with holograms that sparkle in club lights. You'll see sort of sliding opening. You'll see iPod earphones printed on the packs, fairly clearly aimed at a youth market. These will shut down some of that nonsense, but in Australia, the tobacco companies are already looking for ways around that, so they'll throw in an extra free cigarette and make a feature of that. They'll play with prices. They'll throw in descriptive words, so, you know, rather than sort of Benson and Hedges regular, you have Benson and Hedges blue sky, totally powerful, amazing regular, you know. So they're trying to find ways around it. They always do. But it will start coming in the UK from May 2016. And of course, like every other measure, it is being legally challenged by tobacco companies. And so is the Tobacco Products Directive. You know, any significant measure that comes in tends to attract a legal challenge. So there's been a lot of misinformation about Australia, and if you want to know the detail on that, there's an excellent website called Tobacco Tactics, run by the University of Bath, where they collect information, and I always give them the information we have from Scotland. So they've got a Scotland page about plain packaging as well. But one of the interesting arguments is, well, it won't reduce adult smoking rates. And we fully expect them. You can watch this. 8 weeks after it comes in Scotland, they'll be saying, it's done nothing for adult smoking rates. It hasn't reduced them. It's never intended to do that. If it does that, it's a side effect. It's intended to break the branding, marketing, recognition relationship tobacco companies try to establish with kids so that they will buy those brands because they want their friends to see the most visible brands in their environment, that they're buying those. And it will break that. And in Australia, what's interesting is, although it was never aimed at adult smokers, research with adult smokers shows they say the cigarettes don't taste as good anymore. And they're less inclined to pick the pack up because it just doesn't look glamorous. It doesn't say anything about you. In fact, it's pretty horrible because the picture health warnings are standing out there. And a lot of people say they're smoking less. So actually, the adult smoking prevalence rates from Australia are encouraging, with the health warning on that information that they also introduced tax increases, which is one of the really effective ways of reducing smoking rates. So you can't say it's all down to standard packaging, but you can say that the misinformation has been shot in Australia, and there's a good body of evidence emerging about that. They've had it since December 2012. It hasn't increased smuggling. In fact, 0.4 of the smuggled tobacco seized by the authorities in Australia was in plain packs, and the rest was in branded packs. So there's no evidence of the smuggling argument holding good there either. So back to Scotland, we have about a fifth of the adult population smoking. But back in the 70s, it was fairly uniform across our society, and now it's become concentrated in our poorer communities, among people who are sick or disabled or out of work, among people with a diagnosis of a mental health problem. So it's really among our more challenged, marginalised communities that the smoking rates are still high. And these are the figures. So the top line, the smoking rates of about sort of 35–40% are in the fifth poorest communities in Scotland. So the culture hasn't changed there in those communities since the 1970s. And the bottom line is the more affluent communities, where you've got sort of 9%, 11%. Yes?
Do their packaging, does it apply for like when you're buying tobacco from the duty-free and bringing into Australia?
To be honest, I'm not sure about that, because I think duty-free has its own regulations. So I think if you're bringing it in duty-free, it wouldn't apply unless it's covered. It's just within Australia, it's domestically bought.
Even in Australia, duty-free?
Mm-hmm. I would think so, because duty-free has its own separate regulations, and in fact they weren't covered by our tobacco advertising regulations. They had to bring in their own provisions, because it's kind of stateless. So, so one of the issues in airports here was, could you actually have the tobacco somewhere out of sight so that people had to go behind a shelf to get it rather than it being on open display?
And I know each passenger is limited to just buying 2 cartons.
Yes, you have a limit on how much you can bring in. But to be honest, the smuggled and illicit tobacco isn't through those routes. It's the big container stuff that's shipping in, and hand rolling tobacco that's being made up in houses behind blinds and that kind of thing. So in Scotland, we are aiming to narrow that gap. We're aiming to change the culture in our poorer communities. We're aiming to give people the aspiration to move away from tobacco, which people in our more affluent communities seem to have picked up on. And it's interesting because there was some qualitative research done by Edinburgh University in a leafy suburb of Edinburgh with very high income. Parents who smoked would go down to the end of the garden and hide in the bushes to have a cigarette. And in one of the housing estates, which was very economically challenged on the outskirts of Edinburgh, parents who smoked would sit by the window and open the window a bit, or they'd go into the other room to smoke. And both were trying to protect their children, but actually the parents smoking in the house didn't realise until air quality monitoring came in that it wasn't protecting them as much as they thought. And in those poorer communities, people expect to get sick and die in their 60s. They don't expect to live to be 90. They expect to get ill. It's normal. They don't link it to tobacco. They don't get why it's happening. And tobacco is one of the big causes. So we need to raise awareness in those communities and shift the culture so that they drop the use of tobacco as a normal, everyday adult thing to be doing. So the real price of a cigarette, there's several ways of calculating this. One, in health terms, is fairly straightforward. Every cigarette you smoke takes 11 minutes off your life expectancy. If you look at the price of cigarettes bought in a shop, you're talking about 42 pence a cigarette. If you take in hand-rolling tobacco, which is less taxed and is cheaper, and the 10% of cigarettes bought that are illicit and the hand-rolling tobacco that's illicit, then the price is something like 32 pence per cigarette over all communities, all the forms of tobacco. So that adds up to, for a 20-day smoker, spending about $2,300 a year on tobacco, which is a huge chunk out of people's disposable income. And if you take a low-income family with a household income of $18,400 a year, and both parents smoke 20 a day, they're spending a quarter of their total income on tobacco. And it's not a choice if it's addictive. And their environment that they're living in can help them move away from that or keep them stuck in it. So I think for me that's one of the challenges. We have to create healthier environments that make tobacco less visible, put it out of sight, out of mind, out of fashion for the next generation, so that those communities do not suffer the health impacts and the financial impacts of smoking. So one of Ash Scotland's current arguments, which we haven't won yet but we're working on, is to put smoking into the heart of the anti-poverty agenda and say you can really release a lot of income in those communities if people give up smoking. So the calculation I won't go through because it would bore you intensely, but it's in the notes to the presentation. If in our poorest communities, say the smoking rates are around 34%, if we could reduce them by 1% to 33%, it would release an extra £12.5 million in disposable income into those communities. And there's no way that it would be spent on anything as damaging as tobacco. So it's a very good way of looking to up the money available in those families and communities, as well as up the life expectancy and the health in those communities. In Scotland, the picture for 13 and 15-year-old smokers, the 15-year-olds are the blue lines and the 13-year-olds the red lines, is encouraging. We've seen a substantial decline. We're now at 3% of 13-year-olds smoking regularly and 13% of 15-year-olds. And that's the lowest level since modern surveys began in 1982. And just a year or two back, over half of 15-year-olds said they'd never even tried a cigarette. So I think Scotland's commitment to tobacco regulation is moving us in the right direction. But I was saying to Lucia earlier, we cannot rely on that continuing and take our eye off the ball and say the problem's solved, because it could so easily go backwards. This is the current national government strategy, which Ash Scotland was very involved in discussions to develop. And it was introduced in 2013. It will run out in 2018. And the elements are sort of key baseline elements: preventing young people starting smoking, protecting people from tobacco smoke, helping people quit, addressing inequalities in health, and setting an end-game vision saying by 2034, we're not going to make it illegal, but we want it to be out of sight, out of mind, out of fashion, with 5% or less adult smoking rates throughout Scotland in all communities.
Sorry, can you come back to the previous slide? Just for me, why girls smoke more often than boys? Because I always thought that boys smoke more often.
Yeah, I mean, it is changing and it's narrowing the gap, but the theory a few years ago was that younger girls were hanging out with slightly older boys, so they were taking it up sooner. I don't know if that's right, but that was the theory. And the Scottish Government set a world-leading target to halve the exposure of children to tobacco smoke, taking a baseline in 2012 and aiming for halving it by 2020. So Sean Semple, who's a lecturer at Aberdeen University, has been very instrumental in pushing for that target and providing some of the evidence to back up work towards it. And in the last 2 years in Scotland, the mass media campaign on tobacco, because the government says it can only afford one a year, has been all about the dangers of secondhand smoke and about protecting children. Because work that we had funded by the Big Lottery Fund and did in partnership with universities of Aberdeen and Edinburgh showed that a lot of people were surprised when the air quality in their homes was monitored. We took air quality machines into the homes of parents and carers with children aged 5 and under, and we showed them what was happening. And the things that they thought were protecting their kids, like smoking in the other room with the door shut or smoking at the back door, weren't improving the air quality as much as they thought and weren't providing full protection. And a lot of people were surprised that the visible smoke, which goes away in a few minutes, wasn't the real story, because the smoke that does the damage, the ultrafine particles, hang around for between 1 and 5 hours after the cigarette's put out. So it's been quite an awareness-raising piece of work, and important to get that message out there so that people don't forget that it's a toxic substance and it's avoidable, and the only way to avoid it is to take it right outside. This is the endgame vision in Scotland, and the aim is to reduce the smoking rates. We've been going down in a very pleasant sort of downward slope. We have to work even harder to get to 5% or less by 2034. And that means we have to do all kinds of things. We have to support current smokers to quit. We have to make it less likely that kids will get hooked into tobacco addiction. We have to change the environment so that it's just not thought about as a normal thing to be taken up and doing when you become an adult. And one of the really big controversial discussions at the moment is around e-cigarettes, or as the Scottish Government calls them, nicotine vapour products. So this was a device that was invented in China in 2002, went onto the market in 2004. Very clever, high-tech mimicking of a cigarette, aiming to give smokers what they get from a cigarette, with even a little LED tip that lit up when you sucked on it. And we started really seriously tracking that market in 2007. So it's fairly new, it's very fluid. You can't say it's reached a static state. We now have 4 generations of e-cigarettes or vapour devices. The first ones were cigalikes, which look like a cigarette, have a little tip that lights up. And we've already seen one of the companies sponsoring Rangers and Celtic football clubs with tips that lit up in the club colours. So that's very direct, aiming at young people. The cigalikes, some of the dedicated vapors say, aren't as satisfying as the later generation. So the second generation look like a sonic screwdriver or a kind of thick-barreled pen, and they're refillable, and they seem to work fairly well for most smokers and better than the cigalikes. The cigalikes are the ones that tobacco companies are still producing. And the third generation is the tank devices that look more like a hip flask, so have a little refillable tank, and some of them will be illegal under the Tobacco Product Directive provisions. So in a year's time, you won't be able to have them. You'll need child-proof capsules that carry 1 millilitre of fluid or less, which should be about enough for a day, apparently. And then the fourth generation aren't very widely seen here, but they have controllable temperature, so you can boost the temperature or reduce it and sort of get it to where you want it. So what we know is that a number of smokers like them and say that they will use them to try and stop smoking. We don't have good evidence on whether they succeed in stop smoking with them. We have a fairly good idea that they're not as harmful as tobacco, but they're not harmless. And there are some very strong divisions of opinion within the public health community on these. So on the one hand, you have the people who talk about harm reduction, and they're looking at individual smokers, and they're saying the therapies we have, behaviour therapy, nicotine replacement therapy, don't work that well to get people off tobacco. These have the potential to substitute for tobacco or help people get rid of tobacco from their lives. So we should be pushing them very strongly. And then you have people who are looking at it from a public health perspective on a whole society level and say, but then again, what will the tobacco companies do with these? Could they use them to reach a new generation of customers that won't be reached because they're banned from advertising now? Could they become a way of renormalising the look of smoking throughout Scotland when we've done so much to put it out of sight and out of fashion? Ash Scotland hasn't taken a very pro or a very anti stance on e-cigarettes. We've said we need to keep watching the evidence, which isn't there yet. It's imperfect as an evidence base. We need to try and maximise the benefits for smokers, along with a range of other approaches to get them off tobacco, which we know to be incredibly harmful and the most harmful substance. But at the same time, we need to see how it impacts on the vision for 2034 and a generation free from tobacco. So we're sort of balanced. Our sister organisation in London is a lot more optimistic and positive than we are about them.
What's the price comparison? Is it, say, if you smoke 20 a day, is it cheaper to use e-cigarettes, or is it?
Well, the initial investment is more expensive because a sort of sonic screwdriver type kit with the fluids will cost you about £20, whereas a pack of cigarettes will cost you about £8 odds if you buy it legitimately. But the fluid is cheaper to buy, so it is cheaper if you persist with it. But it's that initial investment that creates some problems. So we've seen it more taken up by tech-savvy young people and people with more disposable income than in poorer communities. But sometimes in these poorer communities, people are saying, well, I'll get it for a Christmas present, I'll get it for a birthday present, I'll try it. So it is sort of slightly spreading now. There are about 400 variants on the devices on the market, and there are nearly 8,000 flavours. So a lot of unknowns. You can't talk about them as one class of product. There's a whole wide range in there. You won't be able to see this, but if you go to the Tobacco Tactics website, you'll be able to see it. And it really suggests that in the last few years, although they started off slow, tobacco companies have been buying up e-cigarette companies. And no one yet knows what they plan to do with them. So some of the vapour advocates suggest that they're going to shut down the market. I think it's more likely that they'll use it to have a portfolio of nicotine delivery devices, and they'll try and manipulate that through price and through satisfaction, and they'll try and get as many people as possible staying on lit smoke tobacco because it makes them the most profit. And in health terms, that's not a great outcome because you lose a lot of the harm reduction benefits because a lot of the damage of tobacco is done at low levels of smoking. So if you are replacing half your lit cigarettes with e-cigarettes, you're not really getting any harm reduction benefit. You're still getting as much damage to your health. You have to cut out tobacco to get the benefits. And that's part of the debate that we're trying to bring up in the frame more. But we know that tobacco companies will have a long-term strategy on this, and there are some suspicions that they influenced the European TPD and the twin track system that came out of that. And the only e-cigarette at the moment licensed for medicinal use through MHRA is owned by a tobacco company. So, it could be that they'll just make them that bit less satisfying than lit smoke tobacco. We've seen them engineer cigarettes to make them as addictive as possible. E-cigarettes aren't there yet. They've not been engineered in quite the same way. They're not as addictive as tobacco, lit smoke tobacco. So, interesting. This, I just name check as one of the activities of tobacco companies, although I haven't seen them in the press that much. But Forest, which is a tobacco company front group, last on record with the House of Commons as being 96% funded by tobacco companies and consistently gives messages that chime with the tobacco company messages, set up Action on Consumer Choice. And they are an anti-regulation voice. They claim to be independent, but they are dealing with food, alcohol, e-cigarettes or vaping devices, and tobacco. So we can expect to see kind of pushes like this, which are probably commercially funded and motivated against regulation. And of course, food regulation is one of the issues that's coming up in the frame. So encouragingly, at the moment in the UK and Scotland, it's mostly smokers that are using e-cigarettes or former smokers. But in other countries, we've already seen a shift with young people that have never used tobacco or intended to taking up e-cigarettes. And I would expect we'll see that here because we haven't yet seen the full impact of e-cigarette advertising. It's been tame, it's been unobjectionable. All the e-cigarette ads I've seen in the press here, I could not complain about. They are not aimed at kids. But if you look at the same brands and the same companies in America, you see a totally different picture of the advertising, and they are blatantly aiming at kids. And in fact, there's already been talk of investment in PR companies whose specialities are music, sport, and fashion. We haven't seen that advertising come through. I think that's because we haven't yet seen the regulations come in, and they want to keep their powder dry and not get shut down too much so they can do what they can after the regulations are in. So we know that e-cigarettes are not as harmful as tobacco, but they're not harmless. And we don't fully know what the ratio is. So you may have come across the Public Health England report, which was widely trumpeted, and it said they're 95% safer than tobacco, and that, or more so, and that is at the very optimistic end of the scale I've seen. I've seen, they are 80, 70% safer, and they're 20, 30% of the harm. I've seen that they're up to 50% of the harm. That's the most pessimistic or cautious estimate I've seen. So somewhere between 5% and 50% of the harm of tobacco, which means we need to keep the focus on tobacco because we know the harms of tobacco, but we need to keep a watching eye on e-cigarettes because there are so many unknowns. And as I said, with all those liquids, and we've seen, for example, diacetyl detected in some of the liquids. And that is a chemical which creates a sort of buttery, butterscotch caramel flavour used in popcorn. It's okay to eat, but if you breathe it, it gives you nasty lung diseases, and that's had to be taken off the shelves. There's other issues with heating up cinnamon flavour. It creates some really nasty toxic chemicals. We've seen nanoparticles measured in emissions. So we should be careful to keep the relationship with tobacco. So it's not as safe as fresh air, not as dangerous as tobacco based on what we know. And the Public Health England report, in my view, had some significant gaps. It did not deal properly with the toxicology body of research. It didn't deal properly with the air quality body of research. And it completely omitted an international systematic evidence review by Charlotte Pissinger, who's updating that review for the World Health Organization. And one of the interesting things that she found was that a lot of the research finding no evidence of harm was commercially sponsored. And we've seen that in tobacco, where the tobacco company sponsored research finds everything's lovely, and the independent research goes, hang on a minute, not quite as lovely as you might think. So we have to watch that. And there are a lot of unknowns, which is one reason why we've tried to stay in a sort of uncertain, uncommitted middle position about them. We know that they're not as harmful as tobacco, but we don't know what can be done to make them less harmful. For example, swapping the metal pieces that corrode for ceramic pieces that heat, and that might be better. We know that adult smokers say they like them and they use them to quit, but we don't know if they're succeeding in quitting. And we know at the moment that most of the people using e-cigarettes are or have been tobacco smokers, but we don't know that that will continue to be the case. And I suspect the advertising will drive the market. So our interest as Ash Scotland is in reducing the potential harm and maximising the potential benefits. And we're still feeling the jury's out on a lot of these. Interestingly, Professor Mike Dobb in Australia said we have to be really careful working in tobacco that e-cigarettes are not becoming weapons of mass distraction. Because the tobacco companies would love it if we spend all our time arguing the pros and cons of e-cigarettes and fighting with each other and use our energy on that and just take the eye off the ball with tobacco. And that's where we need to remember that the damage is absolutely certain. And yes?
How about the nicotine patches? For people quitting nicotine patches that people stick on their body?
Yes, well, there is a good body of evidence about nicotine replacement therapies. And used without support, they'll probably double your chance of success. Used with proper expert advice, they will quadruple your chance of success in quitting against cold turkey. They tend to be used short-term. They're not used for long-term maintenance in the way that e-cigarettes are. And smokers often don't find them to be enough, so you can use them in combination with other things like inhalators, which you can get free on prescription in Scotland. So approved therapies like nicotine replacement therapies, Zyban, bupropion, you can get on NHS prescription and your doctor will monitor and work with you. E-cigarettes, there is one device approved for prescription but not yet available on the market. So I suspect they'll, in terms of effectiveness in stopping smoking, they'll probably fit in with the body of nicotine replacement therapies and perhaps be at the slightly more effective end of those. But what we don't know is the whole population impacts of it yet. So, keeping the eye on the ball with tobacco, Ash Scotland in April last year launched the Children's Charter, and this is really a way of trying to make real the commitments in the national strategy and keep a focus on what we need to do with tobacco. And we're asking people to sign up to this, we're asking people to use the Charter mark on events, and everyone that signs up to it, and there's a whole page on our website with all the evidence based to these points and who's signed up, is asked to do something practical. So we're trying to increase the ripple effect of people actually taking action on tobacco. And we've got some really good signatories from primary schools and secondary schools right through to national Royal Colleges, Royal Environmental Health Institute for Scotland, NHS Health Scotland. So it's a good way of sort of quietly trying to change the culture in Scotland. And of course, we are actively seeking to influence the thinking around the May 2016 elections for the Scottish Parliament. So I'll take you through Ash Scotland's manifesto, but it's also a manifesto for our work in the next few years, and specifically for some of the priorities that we've identified in Scotland. And you'll see e-cigarettes comes in there because it is such a big debate, we couldn't leave it out, but it's not the only thing. So the whole frame of our manifesto is tobacco is a piece in the jigsaw of inequalities, health inequalities, and social and economic inequalities, and we want it to be part of that debate. Mental health's an interesting one because, again, I think it's quite hidden. A third of the tobacco smoked in the UK is smoked by people who have a diagnosis of a mental health condition. And with some conditions like schizophrenia, the smoking rates are sky high. They're sort of 86%, something like that. So it's heavy tobacco use. It's a smoking culture. A number of people have relapsed into smoking or taken up smoking when they were inpatients being treated for a mental health problem. And people in that group are dying of smoking-related diseases. They're not dying of the mental health conditions. They're dying because of the tobacco. So we feel we need to shift the culture of people working with people with a diagnosis and engage with people about what they feel the smoking gives them, because it can be very liberating to quit, and it can allow you to reduce the medications you're on, which in itself is a positive and a positive for health. So that's one of our big focuses, and we have already been working with civil servants and government to try and get physical health, including tobacco use, written into the next mental health strategy, and we're getting positive feedback about that. So I think that'll happen. Tobacco retail supply. So the aim in Scotland is not to make tobacco illegal, because that puts the blame on smokers, not tobacco companies, but to put it out of sight, out of mind, out of fashion. And at the moment, there is one tobacco retail outlet in Scotland for every 90 smokers, which seems a bit excessive. And there are 8 times as many retail outlets for tobacco as there are pharmacies. So it's 8 times easier to buy poison than to buy medicine. And we know this because we have a retail register in Scotland, which is free to go onto. But if you want to sell tobacco legally, you have to register. And Niamh Short at Edinburgh University has done some work with colleagues on mapping tobacco and alcohol retail outlets. And there is maps available on the Edinburgh University website that will give you the information about that. So we feel there's work to be done. We used to lobby for positive licensing, but in terms of alcohol, it hasn't worked that well because local authorities don't want to get sued by reducing the number of outlets and knocking people out. So we feel we need to do more about taking people off the register to sell tobacco if they're breaking the law by selling underage or selling illicit tobacco from registered premises. We feel that there maybe should be a charge for selling tobacco and being on the register, but that could be offset by giving support to small retailers to diversify away from tobacco. And the reason they sell tobacco is because it's addictive. And people come in every day and they buy their 10 or their 20 cigarettes. It will be 20 or more after the Tobacco Products Directive comes in. They won't be allowed to sell 10s. But they come in every day and they'll buy a packet of bacon or a pint of milk. And in some shops, although the profit margins on tobacco are really small for retailers, the turnover, the footfall is represented by tobacco quite considerably. So we have to get the retailers on side. We have to reduce the availability of tobacco. So it's a bit more of a hassle to go and buy your cigarettes and maybe you think I won't bother or should quit or, it's raining and I don't really want to go and walk that far to get them. So that's one of our suggestions. Mass media campaigns, particularly television. There's been some good work done in Australia on the amount of television advertising that you need to get the message home. You start off with the concerns and the scare tactics, you move on to the support, and it reaches communities who don't engage with normal health structures and services. So it's quite effective in prompting people who are thinking about quitting to actually make a quit attempt. And in Scotland, we haven't seen mass media for quitting for 3 or 4 years. And I think that's partly responsible for the fall off in numbers attending services and the fall off in people setting quit dates with services. Dementia prevention. People know about the links between smoking and cancer and smoking and heart disease by and large, but the link between smoking and dementia is less known. And we feel it should be known. It's one of the things that scares people, more than cancer, according to some research. And we feel that it would be a good message to get out there to reduce the dementia cases downstream or push them back to an age where you die of something else and it doesn't become an issue. So there's a lot of effort and money and care at the moment going into care packages for people with a diagnosis of dementia in Scotland, but preventing dementia by tackling things like smoking, diet, exercise, alcohol, upstream work isn't really on the radar yet. So we're starting to raise that. I contacted the European Union to try and get this put on as a picture health warning on cigarette packs. And they said, we've revised that 2 years ago, so come back to us next time and we'll think about it. So they weren't willing to put it on at that point. And the links between tobacco and poverty. We feel it's an important part in the jigsaw. It's not the only thing. Obviously, people working in poverty issues are concerned about changes to the welfare system. They're concerned about availability of food and housing, and these are vital things that you have to tackle quickly. But tobacco is an underlying thing that sucks money and health and energy out of communities, and we feel it needs to be part of the debate on tackling poverty and could release a lot of income into those communities and a lot of hope and a lot of better health and longer life expectancy. And our old friends e-cigarettes, we need to maximise the potential opportunities and minimise the potential risks and make sure that they take us towards the smoke-free 2034 and not away from it. And I think we need to keep a weather eye on what tobacco companies do with them. Because as I said, their motive is profit. Although they will talk about being interested in harm reduction, they're interested in harm reduction to their profits. They want to look good. They're not interested in people's health. They've shown no signs of doing anything to reduce the lit smoke tobacco market in any way. And they're still pushing it in other countries, in Indonesia and Africa, where the restrictions are not as strong as they are here, where they can get away with it. So I'm not impressed by tobacco companies' harm reduction credentials in any way. So finally, Tobacco killed 100 million people in the 20th century. It's projected to kill 1 billion in the 21st century. And it kills nearly 6 million people a year. And if a jumbo jet seats an average of 500 people, that would be equivalent to about 12,000 jumbo jets crashing without survivors every year. So, you know, if that was happening and it was preventable in anything else, if it was flu, if it was air safety, something would be done. And tobacco is in danger of being invisible as an epidemic, but the harms of it are very real, the costs of it are very real, particularly in some countries where farmers are bearing the brunt of the costs in terms of their own children being poisoned by nicotine because they're helping to pick tobacco leaves. The tobacco companies are not reimbursing them for the crops, and the soil is degrading because the crops degrade the soil worse than other crops. The land is being used to grow tobacco where it could grow food, and land is being deforested to flue-cure tobacco and produce papers. So I think we're in this together. It is a global problem. It is mediated by global corporations whose interest is profit, not people. And the only possible response to that is for people with an interest in health to challenge it, which I think is really what we're about. And just, I suppose just as a final thought, because I know you're dealing with more health issues than just tobacco, we at Ash Scotland are joining up with colleagues working on alcohol, working on food and obesity and diet, and working on drugs to share learning and to work out how some of these commercial epidemics can be effectively challenged by putting together the intelligence we have and the skills we have. So you're very welcome to contact me if you want to follow up on any of this, but obviously I'm here for a bit to talk to you about it. Thank you.